It will always depend, of course, on the type of sports that they indulge in. So, more commonly is for your upper body exercises, like those who are into racket sports like badminton, tennis, okay, and even, of course, now the pickleball. The shoulder injury is very common, so we call that your rotator cuff tendinitis. No? As similarly, of course, some muscle strains over the elbow, like what we call your lateral epicondylitis. Now, if they're involved in running, jumping activities, then the more common injuries will be that of the ankle and as well as the knee. So more often we have the ankle sprains. We also have the knee sprains, more commonly like your patellar tendinitis or what we call your jumper's knee. And if it entails really a lot of running, moving, of course, and even possibly lifting, is that low back pain will also be one of the more common injuries that we may encounter in young athletes. In terms of the components of exercise, no? And this is something that has to be reinstated among young athletes because there are 5 components of an exercise program. The first one is, of course, as you go through the exercise, first we have what we call your warm-up. Second is we have your pre-exercise stretching. Third is that's the only time you can go about with your regular activities, meaning to say your training, your games, or even, of course, simply your weight training. Fourth is what we call your cool down. And the fifth is that of your post-exercise stretch. So these are the 5 components of the exercises. And each and every one of these should be done by a young athlete or the athletes in general in order to prevent, of course, injuries that may set in. Now, what are the different warm-ups, right? So there are 2 types of warm-ups. Those are what we call related and unrelated warm-ups. So the objective there is to increase the body temperature, to loosen up the muscles so that the muscle tightness would be lesser. And it should be followed by, of course, an exercise or stretching, right? So if doing the stretching prior to an exercise program is mainly just to loosen up the muscles and hoping that we can prevent injuries to set in our patients who have to do a lot of exercises. And of course, then that's the only time that they can actually go into, of course, their actual exercise program. And post-exercise, then it's very important too that they have to do what we call your cool down, which is usually around 5 minutes, 10 down, such that, of course, their body core temperature slowly go down. And eventually, of course, there is no risk of like having syncope or, of course, easy fatigability on these patients. And then the last is the post-exercise stretch, which is most commonly missed out on most of our patients. Like after playing a game, they just take a shower and go home. But what is important is really the best time to improve the flexibility is after doing an exercise. So a post-exercise stretch should be done as part of prevention injuries in our patients or athletes. The other thing is that, of course, when it comes now to exercises, the thing that we always say is that not too fast, not too soon. So what does it mean? Now, in terms of increasing the intensity of the exercise, the dictum will always be like doing it an increase of 10% every week or at least every 2 weeks. Well, one thing very important is that first, in terms of the rehabilitation, number one, we need to establish, of course, a diagnosis. So what is the problem of the athlete? We need to look into, of course, the risk factors, or those related factors that could have led to the injury to the patient, such that we can prevent it from happening. So a thorough physical examination, evaluation, and looking at the risk factors that led to the injury of the athlete should actually be looked into. After which, we can do certain diagnostic tests to actually look into the injuries. So we're very heavy on musculoskeletal ultrasound, and even, of course, if there's a need to do an MRI or a simple X-ray. In terms of the rehabilitation, it will always depend on, of course, the goal of the athletes, okay, in terms of recovering, okay, as well as the same time is the type of athletes we're dealing with, no? So some professional athletes need to be going back to sports immediately, so we need to enhance their rehabilitation program. So it has to be, of course, ideally seen by a physical medicine and rehab doctor, just like me, who could actually provide them with an extensive program when it comes down to the rehabilitation and eventually return to sport of the athlete.